So still on the Rcgp case cards, guys. This particular case card says, explain the benefits of the influenza vaccine to a 62-year-old diabetic man who has expressed worries about its side effects to the practice nurse. Thanks for coming to talk to me about the flu jab. I gather from the nurse that you have some concerns about it, about whether it's worth having and safe with your diabetes. The main reason we offer the flu jab to people with diabetes is that if they do get flu, they are at greater risk of complications. Flu in itself is not pleasant, but the vast majority of fit and healthy people will get over it just fine. In diabetes, if you get a flu, you could end up with pneumonia, dehydration leading to kidney failure, heart failure, or serious difficulties controlling your blood sugar. Sometimes people worry that the flu jab can cause flu. In fact, this isn't actually possible because the flu jab has no living virus in it, just harmless bits of the virus. Whilst it should prevent you from getting this year's strain of flu virus, unfortunately, it won't stop you from getting any of the common or garden cough and cold viruses going around. You also need to have the flu jab every year because the virus changes every year. It's still early in the season, so why don't you have a think about it? And I'll give you a little more information to read up on. I would strongly recommend having the flu vaccination or the flu jab, which is usually annual, and it's a killed vaccine, so it doesn't contain, it's not a live vaccine, so there's no chance that the patients could develop a flu from it. The next Rcgp case card says, explain perforated eardrum, post-otitis media, and aftercare to the parents of a 4-year-old Ruby who is currently asymptomatic. Ruby's recent ear infection has left her with a hole in the eardrum on that side. The eardrum is a thin membrane or skin between the outer and middle compartments of the ear, which vibrates to pick up sound. An infection in the middle ear can cause the drum to burst, which actually helps the infection get out. Most ear perforations heal by themselves within 6 to 8 weeks and need no treatment at all. They heal slowly in the same way skin on the rest of your body repairs itself. As the eardrum is not intact, it won't be vibrating normally, so Ruby's hearing may be affected on that side. This should return to normal once it has repaired itself. The main thing to be aware of is that the middle ear compartment is now open to the outside world and can become prone to infection. You should avoid getting water into the ear until we know the eardrum has healed. No swimming, I'm afraid. During a bath or shower, use a large ball of cotton wool sealed with Vaseline to plug Ruby's ear. Remember to remove it as soon as she's out, in case it starts soaking up water. Some people choose to buy waterproof earplugs instead. I would like to see Ruby again in 8 weeks, which is 2 months, to make sure it has healed. Very occasionally, if it doesn't heal, or if the hearing doesn't return to normal, we would ask the ear specialist to take a look. Bring her in sooner if she develops signs of infection such as pain, a a temperature, or a discharge from the ear. So that's your safety net. The next Rcgp case card says, discuss heartburn with a 45-year-old non-smoking male who has no red flag symptoms and doesn't take any medication. Heartburn or reflux happens when acid from the stomach moves up into the gullet or esophagus, which is the food pipe. This can sometimes inflame the lining of the gullet. Many people find heartburn is made worse by certain foods. Caffeine, alcohol, and spicy food are common culprits. You need to try and work out what makes it worse for you, so that you can choose whether to leave them out of your diet or not. You should also avoid anti-inflammatory tablets such as ibuprofen, as these can aggravate your symptoms further. Often, the reflux is worse when you go to bed. Try lifting the head end of your bed with bricks or books and sleeping at an angle if your partner will let you. Not eating or drinking for a couple of hours before you lie down may also help. Stress can make heartburn worse. Are you stressed in any way at the moment? Losing any extra weight you might be carrying can improve things too. Antacids, which you can buy from the chemist, are useful, but I can prescribe you a more effective tablet to reduce the amount of acid in your stomach. I recommend you take it for a month, then stop. If your symptoms return, I need to see you again. I don't think there's a serious cause for all this, but I need to see you again if you lose weight unexpectedly, get any swallowing problems, vomit blood, or pass sticky black stool. So your safety net, your alarm, you have to discuss the alarm symptoms as your safety net. I don't think there's any serious cause for all of this, but I need to see you again if you start losing weight unexpectedly, if you get any swallowing difficulties, if you start vomiting blood, or passing sticky black stools, Melina. The next Rcgp case card says, explain acute otitis media to the mother of a 4-year-old James. Ear infections are common in childhood. When children get a cold, infection can get into the space just behind the eardrum. This infection can be due to a virus or a bacteria, and cause the eardrum and space behind it to become red and sore. Sometimes ear infections can happen just out of the blue, in the absence of a cold. Most ear infections get better on their own in 2 to 3 days, because your immune system fights the infection off, just like it does with a cold. If the infection is causing him pain, you can use paracetamol or ibuprofen to help with this. These medications will also lower his temperature and make him feel better. Antibiotics are not usually needed, especially as James is over 2 and his eardrum is not severely inflamed. If he doesn't start to get better in the next 3 days, it may be worth thinking about antibiotics at that point. I would like to see James again if his hearing doesn't improve within a few weeks of the infection, or if you are worried he's becoming more unwell. So your thinking is likely viral acute otitis media. But then you also need to know advice if he's not getting better within the next couple of days. If you think he's getting worse, if the pain is worsening, if he becomes hot and cold, feverish, if he stops wet, if he's having fewer wet nappies, appetite is going down, or if he's getting worse, you want to see him again to reassess. The next Rcgp case card says, discuss chronic back pain, no red flag symptoms, with a 47-year-old woman who has had several episodes of pain since her 20s. So you've had back pain in the past. There are lots of things that can cause back pain, from serious causes at one end of the spectrum to simple muscular pain at the other end. I think you are suffering from the muscular type, which can be just as painful. So empathy, which can be just as painful. I'm very reassured that you don't have any problems with pain or with your bowels. If you were to get any symptoms like accidents with your bowels or not being able to pass urine, you must let me know that day. Other worrying symptoms would be your legs not working, losing strength, or numbness down below when you wipe. Worrying things aside, we need to deal with the pain so that you can get on with life. Let's talk about your painkillers and think about whether physiotherapy might help. As you are getting pain despite ibuprofen, it's probably worth trying another tablet in the same family. I would suggest naproxen, but as it can cause heartburn, I'll give you a tablet to protect your stomach. You can take paracetamol in addition if you need to. Nowadays, the advice is exercise and keep going. So don't take to your bed, as you will find the muscles can stiffen, making things worse. If you rest, you will rust. You should definitely avoid bending, lifting, and straining your back in any way. Would you like me to refer you to the physiotherapy team? By working on strengthening other muscles and the tummy, and by learning to lift properly, we may be able to prevent worsening back pain in the future. By working on strengthening other muscles and the tummy, and by learning to lift properly, we may be able to prevent worsening back pain in the future. So chronic back pain is something that is very common, musculoskeletal back pain, very common in primary care and in life as a whole. Okay, people develop back pain usually, in middle age. By the time they start getting to 40 and above, a lot of people begin to develop back pain. This is the last Rcgp case card. Actually, you can go through other ones in other videos. So this is the very last Rcgp case card. So we're gonna give it a kiss. And it says, explain viral induced wheeze to the mother of a 3-year-old boy. The noise your son has been making is called a wheeze. It's a sound that's made on breathing out when the air passages are narrowed. Because he's had a runny nose and temperature, as well as the wheeze and cough, the most likely cause is a viral infection. People often think that wheeze must mean asthma. But viral infections also cause it by making the airway twitchy, sensitive, and narrowed. I'm expecting these to settle completely, but some kids get wheezy with every cold. They usually grow out of it. It certainly doesn't mean he will go on to develop asthma. Like any viral infection, antibiotics won't help because they only treat bacterial infections. Most viral infections are self-limiting, which means symptoms will settle by themselves over a few days. It's sensible to give paracetamol syrup if his temperature is up, and to make sure he drinks plenty of fluids. The cough and wheeze can last a little longer than the infection itself as the inflamed airways settle down. So I'm going to give you an inhaler to try when he wheezes, which will relax and open up the airways. You will need to use a thing called a spacer, which makes it easier to get the medication into the right place. Come back in a couple of weeks if he's still wheezy. So as I said, this is the last Rcgp case card. You can find other Rcgp case card discussions in other videos or other short videos which I've done. Really good revision for the SCA because I'm preparing for my SCA, so obviously I have to revise ways to communicate, several medical conditions better to patients, or in this case of this SCA, to the actors who have to be treated as patients, because the SCA is simply an exam where you are assessed, where the examiners want to see you perform as a general practitioner. So it's not really an examination. It's more of them just watching you do what you normally do as a GP trainee, in this case as a newly or a potentially newly qualified GP. So we've come to the end of this video. Cheers, guys. Cheers.